Hey, get in, fellas. We're going to therapy. Welcome to session 19. Stoked today to get through a bunch of good stuff. We're going to start off with one of my least favorite words, actually, and how it implies surprise and what we can do to be more aware of how we talk and what we mean, what we say. We're going to get into development, a favorite topic of mine with my good buddy, Dr. Bill Christie. So important, in fact, that it's going to take us 2 weeks to get through. All right, we're going to learn about how we develop sexually, cognitively, morally, and the Ericksonian stages of development, which really are the foundation of what we know and think about development most commonly. Finally, we're going to celebrate that today is the return of the show that had me fall back in love with being a therapist, shrinking on Apple TV by inducting Jason Segel into the Bro Motions Hall of Fame. Gonna be a good one. Let's go. I want to start out this week with something that really grinds my gears, and it's the way we use the word actually. Sit for a second. Have you ever had anybody say something along these lines? You make them dinner, and they finish the plate and go, that was actually pretty good. You're watching a TV show that somebody recommended. They say to you, I was actually entertained by that. How does it feel? Because I know when this happens to me, my perception is like, what? You're surprised that my meal was good? What? You're surprised that my television recommendation was entertaining? And so I want to bring this to people's attention. Are you aware? Was I aware? Are we aware that when we use the word actually like that, it implies that we're surprised? There are plenty of times when this is appropriate, that you did something that you really, really thought was going to be hard, and it actually turned out to be much easier. That implies you were surprised. When you say that party was actually fun, when you say that meal was actually good, you are signaling to that person that your expectations for them were low. Why would somebody want to do that? It's our own negativity that's coming out onto this person that we should all be more aware of. I try to catch people when they're doing it. Hey, did you think that was not going to be good? Are you aware that when you say that you're surprised or that you're expressing that to that person? It usually throws people back a little bit. So I want everybody to be consciously aware of that the next time that they're responding to somebody with like, that was actually pretty cool. What? You thought it was going to be lame? So just be mindful of that language, because I know when I hear it, it hurts. And I'm sure I've done it to other people and it can hurt too. So remember, that actually implies surprise. And let's try to be more positive and more effective in giving feedback to people. Hey, I really appreciate that recommendation you made. Or wow, that meal was really good. Or you do make that a lot. There's other ways that we can respond to people in a way that lets them know that we appreciated them or appreciated their recommendation or appreciated the party, the meal, without, sending the wrong signal. All right, short rant over. We're going to transition to an important 2-part conversation with a good buddy of mine, Dr. Bill Christie, about development. How we develop from our early years on into adulthood in terms of a bunch of different topics, our sexuality, our cognition or thinking, our morals, and themes that we need to accomplish each block. So I'll see you back here after the break and get ready to learn. All right, only the second in-person interview that I've been lucky enough to have. So we're welcoming back the good Dr. William Andrew Christie, a native of Pittsburgh, Pennsylvania. You might remember this speech because Bill tried to join us for Eric's episode 5. And as we're going to learn, he works in Gillette, Wyoming, where he serves as the only psychiatrist in the city. And they don't have good enough internet to support a podcast interview.
There's more now.
Oh, you're not the only one. Well, that helps with the workload. So Bill grew up in Pittsburgh, so unfortunately, he is a Penguins fan, so I had to rep my Ohio State hockey jersey. We're often Steelers-Bengals beefing between the two of us, and I owe Bill a lot for being the person who taught me how to ski out here in Colorado. So, my family in Ohio may hate it because now I'm stuck here for skiing purposes, but you know what? It's been a great journey for me. And so Bill does what he calls travel nursing, but for doctors. So he's like a hired gun that goes out to Wyoming and covers a lot of different turfs. So talk about all the different stuff you do.
I get to do a lot of flavors of psychiatry. I do spend the mornings on an inpatient psych ward that has adolescents, and then a separate area for adults. And then in the afternoon, I see clinic patients just in the office. And those patients are anywhere from 4 years old to 84.
That's cool.
And then I also am responsible for covering the emergency room. There's stuff going on there. We're seeing consults in the rest of the hospital. I train some students, and so I get to kind of be a jack of all trades.
Yeah,
there, and or master of none.
Yeah.
And then I get to leave and not think about it.
That's pretty nice, because he's 1 week on per month. Is that what it is?
Yeah, 1 or 2 weeks.
Oh, nice. Yeah. Bill, if you were hearing that right, he does what Satish does sometimes, what I do sometimes, what Tarek does sometimes, and what Demko does sometimes. So that's like a nice balance of keeping it fresh. And so I brought Bill on because we did child psychiatry fellowship together out here, and we're going to make our boss, our fellowship director, proud today, because we both trained under the good Dr. Kim Kelsey, another fellow Canadian that's a part of the show. And we said, hey, 2 of your most famous distinguished alumni are going to talk about development on the internet. So I want to make sure we gave her a shout out because she's the one who taught us all this good stuff. Pour one out for the Edmonton Oilers and Connor McDavid. I know that made you very sad, Dr. Kelsey.
So, or another one out for Dikembe Mutombo.
Oh,
and for Pete Rose. Maybe, you didn't make the Hall of Fame. Is he going to make the...
I wonder if it'll be posthumously. Yeah. And so that gives you a timestamp, because that was yesterday on September 30th, both those passings. And we're airing this on October 16th. And so I figured you heard Bill just talk about it being 4 to 84, or that he kind of really does see people womb to tomb, cradle to grave, like I've talked about a good psychiatrist should know. And so today we're going to talk about development. We've talked about development before, guys. This is the idea that people are kind of meant to be learning different things at different points throughout their life. And so there's a bunch of different people who've had a bunch of different thoughts on this. So we're going to go through a bunch of the big wigs over time. These might be names you've heard of if you took Psychology 101. And everybody's had different kind of thinking about the, personality development and stages and what's important and who, this stuff. What do you think about development, Bill? Like, how does it inform your clinical practice as far as seeing patients?
I should give the caveat to, that like Doctors Demko and Sakshi Dara, I don't have therapy patients that I follow every week.
Yeah.
But in the course of my work, there are lots of opportunities for brief therapy interventions. And I think that knowing therapy and being able to sort of come up with a formulation of what's going on in someone's life or what's going on with their personality, the broader picture of their development, their environment, etc., also helps inform diagnosis. And then whether I use a med or whether I say there's not a med that's going to change this aspect of what you've been through in your life or aspect of your circumstances. And so then can steer them, someone like you that's doing more therapy. And not, had big pharma's pockets. Set them up.
So, Bill, I covered a lot of stuff that our listeners may or may not have picked up on previous episodes. So the idea here for Bill is that we have things to learn from understanding development. So the reason these lectures have built on each other as they have is that we're going to go through all these different types of development. And it's about how just because we get older, it does not mean we grow up. So the idea is that your development, however you want to view any of these things, and we're going to talk about what happens with each of these theories when your development gets stunted via trauma. That's the idea, is something happens that kind of stops your development. And again, that can look a million different ways. So this is the same thinking that we need to do when we're trying to have empathy for people, right? And so the idea of like, why does this person struggle in this way? Like, why don't they just do the thing that grownups are supposed to do? And if you can understand the way that we're supposed to learn things, in general order, then you might be like, oh, yeah, this person's functioning kind of like a 10 or 12-year-old because they're still trying to figure this thing out. Now, that's really high-level thinking for our audience, but to me, it feels like it's within grasp. Like, people can use that to build empathy.
Yeah, or I think at least maybe get some insight into what you're experiencing. You want to bring that insight into therapy with you, because insight isn't the same as changing your behavior. But thinking about, like I went through some really hard shit at some point in my life, and, just having kind of a developmental framework could maybe help you reflect on what it might be that you're stuck on, and how does that, kind of fit in with what you're experiencing. I know for me, that definitely is something that I use, like where I'm not necessarily discussing these stages of development or talking to patients about them explicitly. I'm often thinking like, okay, so you went through some trauma when you were 15, or, your parents were stuck in the C-suite and you never saw them for, this younger period of your, like what might you be dealing with later on? How might that play?
And there's some of these theories that you're going to be like, well, how applicable is this? Does this really matter? And then we're going to get to the end, which is the Ericksonian stages. And that's the most common kind of developmental theory that people really know about. It's like really common, taught in college, taught in high school psych class. And that's one that I think is going to feel really applicable to people, because this is what I'll use with patients. And it's like, maybe the conflict in your relationship is you're ready to move on to this stage, but your partner's still kind of back in this stage. And people can jive with that, especially young adults. And we got plenty of young adult listeners. Sorry, fellas, that women's maturity often outpaces men in their 20s, especially. Right? So women in their 20s, still dating their college sweetheart, are gearing up. They're ready to step into that adult role, their career, their marriage, their kids, far before the young men are. And I'll tell you what, I've worked with enough 25-year-olds all across the country who would be like, fucking preach, Dr. Solomon. These 25-year-olds I see on Hinge all still want to just like party and not take things that seriously. Denver is known as the land of the lost boys, because people come out here just to party and go to shows and do drugs. And it's like, that's fine. They can stay at that age, and it just doesn't appeal to women who are ready for something more serious.
I would say, having taught middle school, I think it probably starts a little sooner than that.
Yeah.
It's anecdotal. I don't have data to back this up, but it just seemed like the girls, they're all dumb and they all do stupid.
Both genders are dumb. Not just, it's what, all genders. Yes. Humans, when they're middle schoolers, do dumb shit.
The boys just are like next level.
Yeah. Idiots. Yeah, for sure. Yeah. It's a good call. I kind of was just getting excited about Bill's intro. So part of what is Bill and I have jived about is not only that we did this training together and we both, worked at CU, but he did Teach for America, and I did a program called City Year. So two different, nonprofit-based, volunteer-type programs in education. So we both worked in inner city elementary and middle school, and it's really formed our experience and how we work with people. We're going in an order of how we saw importance or things that people would really benefit from knowing. We're going to go through Freud's stages of psychosexual development. The earliest Freud stage is called the oral stage. And this is essentially you experience things, you experience sensations through your mouth. And this is not a surprise, because we see babies put stuff in their mouths, they chew on stuff, they teeth, right? And so when you've struggled to master this phase, you end up with an oral fixation, if people have heard that. We talk about smoking and like wanting to have something in your mouth. It implies that part of that period of your life didn't go according to plan.
And the next stage then is the anal stage, which characterized by toilet training, early toddlerhood, where kids are learning to hold on to their poop. And there's the idea is that if you're in a very strict environment where you're punished if you poop yourself or if you screw up, then you might grow up to be anal retentive. There's a lot of other, like stick up your ass, like that sort of, idea is in the vernacular.
Yeah.
Whereas, if your parents like don't care and you're pooping all over the place, then maybe you're a little loosey-goosey later in life too.
As strange as it seems, that anal phase in the term, it's like, okay, it's about control. We know that toilet training is about control for kids. And so there's not a lot you can control in your world as a toddler. Lord knows you can't control your emotions. So your parents are like, do this thing on the toilet. And the kid's like, fuck you. Why? That's why we got to do the sticker chart. And I like that out of toddlers. They're little assholes and they get their needs met. And I respect that. So the next phase is called the phallic phase. This is essentially the Oedipal complex phase that Zach and I talked about. So the idea here is that, and again, a lot of Freud sexuality stuff coming at you, that you identify more with the opposite gender. And again, if you're thinking about gender stuff, we're explaining how things were over 100 years ago, right? So these theories have kind of grown and changed. But the idea here is that, like the Oedipal complex, the son identifies more with the mother and sees the father as the enemy, And a daughter identifies more like romantically connected intimately with father and then pushes the mother away. And so that's, what we do see. I know it's like a strange concept, especially as gender gets more neutral. Zach and I talked about the Oedipal victor. If this stage goes incorrectly, that there's usually an unusual relationship with one of the parents. So again, if a son, doesn't have a father figure to kind of be put down and say, hey, you aren't romantic with mom, that's not how this goes, then like Tony Soprano, we continue to have weird fucked up relationships with our moms as men and vice versa. So what this can look like if this doesn't go smoothly is this often leads to a lot of sexual anxiety, obsessive traits. Latency is the elementary school years.
Yeah, and latency, the idea is that you kind of take a break from a lot of this sexual stuff.
Hence latency, right? It's like latent.
Right.
Yeah.
And so it's simmering down there somewhere, but it's just not at the fore. And, which is convenient because then kids can focus on their school and learning how to be little people.
Yeah.
And, and it's, it's maybe the only time in their lives that they don't have to stop playing a role for a minute to not have the distraction.
So when we talk about the Ericksonian stages, that latency time is when you're like set to master things, right? So it's like Bill's like, yeah, you get good at your schoolwork, you get at sports. What we notice in that time is the play becomes separated by gender. And so the kids, when you're like 3 to 5 to 6 is when you play a lot of house, a lot of mom and dad. You get married to each other's like little neighbors and weird cousin shit happens, Arrested Development shout out. Latency is identifying with the same sex gender.
Girls are gross. Like if you're going to interact with them, it should be just to kick them in the shin.
Right.
And run away.
Yeah.
And, girls have clubs and the boys aren't allowed in the clubs.
Right.
Maybe with some exceptions if you're special, but
yeah,
mostly like, nah.
Yeah.
And you see a divergence in the genders.
Little Rascals is probably a good example, right? Like,
of course,
it was all guys. They had kind of a tomboyish figure. They had the one girl who was like pined romantically, so kind of that stuff like bubbling up for them.
Maybe there's a token and, one for the other. They're pretty sick.
Right, totally. And then the last phase of Freud's psychosexual development stages is the genital phase. And so this is kind of the rest of your life, defined most regularly as like ages 12 and up, 12 to 18. But this is when you start to sexually be attracted to the opposite gender or identify kind of with what it is the rest of your life, which is like you care about sex. It is important. You are experiencing the world through Freud's view. You're experiencing the world with your genitals. And like, look, that sounds intense, except as Bill said, people are thinking about sex all the fucking time. Not fucking time.
Yeah, and while it might not be everything, you really can't divorce it from other social motivators or thought processes that are going on that are shaping people's development. A lot of the other theories don't bring it up at all necessarily.
Yeah.
And I think it's important to shout Freud out, even though it's kind of weird, especially in middle school, adolescence, people are getting slammed with hormones and doing wild shit in the interest of garnering attention from the opposite sex.
Yeah. And I wonder a little too, like if teenagers were in this whole society allowed to explore these things a little more, then they wouldn't have such extreme reactions at other points in life. I think we all know the example of, a kid who partied hard in high school and then in college, they were just like, I don't really need to do this. I was able to kind of express this part of me. Or same like in college, right? If you have this phase where you're able to have promiscuous sex, get drunk, make mistakes, then it cools off for most people.
Yeah. Or if you're like a doctor, for instance, and you've been on your grind because you had real, type A parents, they were like, you must study at the expense of everything else. And so through middle school, high school, college, you just grinding hard. And then finally you make it into med school and just completely go ham and explore.
I thought you were in the Wheaton Underground. That wasn't your experience.
Necessarily my experience.
Bill did go to Wheaton College, a really good Christian school up in Chicago. And am I allowed to out you in the Wheaton Underground? So Bill was a member, as he explained to me, of the Wheaton Underground, a generally dry campus. But Bill did get a little PG-13 rated, which was not cool. Maybe even R. Is it like as intense as BYU?
I've never been to BYU.
Well, you can't like do anything. Yeah.
Like,
Okay.
it was
Yeah.
all the underground as if it was like West Point. Like if people found out you're breaking the rules out of concern for your spirit or your heart,
Mm.
they
Mm.
would switch. And so, you had to, it's never, partying has never been as exciting.
Yeah. Yeah. The risk, like, yeah, you were both underage and your whole education was on the line. It's funny. So even in the kind of think about this, like in this kind of weird Freud stuff, as we kind of say it, but like we're finding ways to attach it to like any of our experiences. We're going to shift into Jean Piaget's stages of cognitive development. If we remember CBT, cognitive means our thoughts. So this starts with the sensory motor stage. And again, that's not much different than what Freud is saying, is that, we're experiencing the world through our sensory stimulation. So we're getting our coordination. We're kind of understanding things, how they taste, how they smell, how we move, how we touch things. And most importantly, this is when object permanence happens. And so I love to give this example because before you develop object permanence, peekaboo is legitimately fucking magic for children, which is why they love it so much. When you cover your face up and you open it back up, that is object permanence. And so kids, when they're in their first individuation, which is when they start to walk and can run away from you, they haven't quite yet developed object permanence. And so they walk away, and then you've seen toddlers kind of peeking their head around the corner, right? That's like a safety thing. And also because they really don't know whether you're still there as they try to establish safety in this world in terms of kind of getting away from your parents. So we'll think about individuation at some point in some parenting lectures down the line, because it's interesting stuff. But otherwise, the sensory motor stage, yeah, it's pretty straightforward. We're kind of learning language during this stage. This is when we start expanding our, kind of getting into speaking and communicating in that way.
And then pre-operational is the next stage, like 2 to 7 years-ish. And this is, perfect time, where kids are learning language for them to be able to understand that certain things can represent other things.
Mm-hmm.
And so they can use whether it's a word to represent something, but also like a toy in play. Like kids will pick up, even if it's like an animal toy and say that it's their mom and act something out with it. But also can realize that they can use other frames of reference to kind of communicate ideas with the adults in their life and get their needs met.
Yeah.
But it can't do a whole lot beyond
else, right? And this is why it's like you want to talk to a kid about like time, money, numbers. Like you're like, give this kid's like, okay, we have 30 minutes. And this kid's like 4, 5, 6. They're like, I don't know what the fuck that means. And I'm just going to keep going on living my life, but it's like they can pretend to play doctor and the stuffed bear can be them when they go to the doctor, right? So they understand things about the world and they're learning, but it's not like they know the address of or how we drive to the house, how we get to the doctor's office. Concrete operational. So again, operation is how we like function in the world and how we're seeing it. So, that's why pre-operational is like you're not really operating out in the world, So concrete implies that we're getting there, but everything we do is pretty rigid. And this is, again, ages 7 to 11, where we know kids to be pretty rigid. Again, it's gender-based rules. It's, kind of an obsessive time where it's like, no, don't don't touch my Pokemon cards. Like I have them stacked like that for a reason. Kids get into Legos. They get into things like that are all about kind of like keeping a locus of control in the world. So this is when time, space, and quantity get introduced, these more abstract concepts, but they're not really able to like mold them together, right? You wouldn't be able to say like, I need you to meet me here in this amount of time because that's too many things. They can't really blend the things together.
And then formal operational. And did you teach 4th or 5th grade?
3rd and 5th.
3rd and 5th.
Yeah, just like bits of.
So you would have seen like either end sort of this formal operational, or just as kids are sort of transitioning through. And I think the difference between 3rd and 5th graders, you can tell me if your experience doesn't jive with this, is that 3rd graders, they're still in that space. 5th graders, they're just gaining this ability where they're like, shit, I can kind of think like an adult.
Yeah.
And if you tell me to do something, I don't just say like, oh, okay, yeah, because teacher said so. And I'm like teacher and she's bigger than me and the adult. It's like, but wait, why? Why do I have to follow these rules? And so, this is about when kids start getting attuned because they're suddenly capable of sort of like theoretical, more abstract, hypothetical concepts and they can say, but like, I don't
agree with
this
that.
doesn't, if this doesn't make sense to me, then I don't feel like I need to do it. Whereas younger kids will say like, it doesn't need to make sense to me, or you're just, the fact that mom says this, is enough sense that I need to, to follow the instructions.
Totally. I had third grade, my biggest thing that stuck out to me, and this is just how it was from third to fifth grade. Third grade was very much like latency and the kids doing individual gender stuff. They like to play sports. They like to do whatever, they kind of were in their own world. And then fifth into sixth grade is and we know that adolescence has become earlier because of social media and because of the way the world's changed. So generally, these kids are starting to think about romantic relationships at younger and younger ages. And so I was having fifth and sixth graders who were like doing stuff you shouldn't necessarily be doing as fifth and sixth graders. So that was my big takeaway, was like, oof, that changed fast, kind of that third, fourth, fifth. Bill's done a nice job here thinking about moral development as we've gone. So that's a Lawrence Kohlberg thing. And there's 6 stages of moral development. They're kind of bundled into 2s. And so we start with the first stage is the obedience and punishment stage. And this is the idea that the reason you do things, or your moral reasoning, is based on either getting a reward or avoiding punishment. And so I joke that the best example of this is young kids are like dogs, okay? And that makes dogs really smart for dogs, and then kids really dumb for humans. They only can live in this moment. They don't think about the future. I'm in this world for rewards, and I'm here to not get consequences, which is why kids lie. This is before they understand, right? That moral development, they're going to lie a lot at this age. And because they're like, well, if I admit to this, it's going to go wrong. And so they have to learn. This is when good parenting comes in and says, hey, we tell the truth in this house. That's most important, right? And so you really want to make sure you're striking that balance, because look, as gentle parenting becomes more positive, more popular, there's a role for punishment. And I'll never really back off that, because kids need to understand that. It's like, not an accurate portrayal of the world if they don't understand that their actions have consequences, especially when it comes to safety, right? If they're going to hit other kids, if they're going to, steal, if they're going to, do things that they should understand aren't good, then they need to have consequences.
And then stage 2. So once kids landed about 7 until 9 years old, so that sort of like second, third grade range, that sort of shifts from just avoiding punishment to, okay, like now, rather than avoiding something bad happening to me, I'm going to try to make something good happen to me. And also, I realized that, I can maybe trade, if I scratch someone's back, maybe they'll scratch mine back, as they're doing more with their peers. And so there's, this is an age where there will be a little more negotiation, like that. Yes, I'll like clean my room if you give me candy.
Right.
Or I'll share this Lego set with you if you give me a turn on the game.
Yeah. And the idea here is like, if you don't grow beyond this stage, then you're still seeing the world as transactional. You're still seeing the world in negotiation, like eye for an eye, tit for tat, these kind of ways that like, it's like a way to operate in the world. But generally, if you're fully developed in terms of your moral reasoning, as we're going to see, it's like you can separate yourself from these individual interactions. We need to be thinking about the greater good. We need to be thinking about justice and people's rights. And that's what we're going to get into a little later. So the next, the conventional level of moral development starts around age 10, kind of these pre-adolescent years. And it's about having good interpersonal relationships. And so what we're doing and we're focusing on is kind of living up to societal expectations and roles. And we want to be seen as a good person. So this is a lot of elementary school stuff, right? We play by the rules. We don't cheat. And so when you do cheat, it's like everybody freaks out, like elementary, 4th, 5th, 6th. I'm sure you've all been with young kids who, if they think someone's cheating in the game, then the game's over because the whole table's getting flipped.
Yeah. And this, I think it lines up nicely, this age group, which is, 10 to 15 generally, lines up nicely with that sort of form operational where, rather than just like, here's this, I want this in return, it's very concrete. They can think about, well, what is fair?
Mm-hmm.
What is the, the policy here, and get upset about those things instead of just, lack of reciprocity. So then, also sort of, the next stage of like 12 to 15 is a stage at which people start trying to maintain a social order. And I think this also fits with this sort of a period in adolescence. I'm sure everyone can relate to an extent. Like you start, the focus shifts from like, oh, I want to make my mom happy, my teacher happy, to will my friends think
it's middle school.
What do I look like? And, you feel like you're on a stage 24/7 and everyone is watching you all the time, to the extent that some teachers, where I taught, would like put mirrors in the front of their classroom so that everyone could just look at themselves and make sure they look cool so they weren't distracted by the entire class period.
It's one way to try it, man. I mean, it's pretty hard to rein in out, middle school kids. So
it makes sense that this, this infatuation, your preoccupation with what everybody's thinking of you would also motivate your behavior and your development as a term, in terms of morality, or you like to see.
Right. It's conformity at the max, right? Like this is the stage where you conform and you haven't quite started rebelling yet. So this is, I think about this as like, don't argue with the refs in sports. You're going to respect your elders. You're going to respect authority, right? So those kind of concepts of like a conformed, orderly society.
Or it's like, if you fuck up, the whole team is running laps.
Like that.
The whole team is mad at me.
That's the motivator.
The worst possible.
Yeah. I talked about this because I talk about it all the time. Like, this is the prime time for like when you're a middle schooler and you want to talk back and they slam you down. So if you internalize that idea and you don't really grow from there, well, then you've never really learned how to advocate for yourself, because that comes later. So we're talking about post-conventional moral development next. So that's ages 16 and up. The fifth stage, that social contract and individual rights is what we call it. So it's the idea that like laws and rules are made to promote the greater good. That's usually what people think. And so it's funny because we often think of late adolescence, 16 to 18, which actually carries on a little longer now because development is both earlier and longer than it once was because of social media, that you really do believe that the rules are made to benefit everybody. And it's like an idealistic, like rosy-eyed view of the world. But it's also amongst the first time that you're kind of thinking about the world at large. Your eyes are opening up and you're kind of being able to see that moral reasoning involves more than just whether I'm getting something out of it or not.
Yeah, I feel like this is the age, maybe, we're starting to see kids, at least when I was this age, that the war in Iraq and Afghanistan was going on and kids were like sitting through the Pledge of Allegiance, which in hindsight was incredibly based.
Yeah.
But at the time, in my conservative Pittsburgh suburb, affluent suburb, was like, whoa, but kids are starting to think about the world beyond themselves and to give a shit.
Yeah, this is like a lot of the hippie movement, right? Was underage kids that were 16 to 18, or right when they wanted to leave the house, they wanted to go out to California and join the protests. And that stuff still happens, right? So as we move on to the final stage, this is kind of the transition from high school to college. This is when the laws and kind of morals get more personal. Like you have your own moral compass. And so it's the abstract reasoning we can use as we talked about the cognitive stages, right? This is the point where you can say, hey, do I care about this law? Does it apply to my rules and my values and how I see the world? And this is depending on who you are and how that presents, truly it is the sign of the final maturity. Whether you act right or not is speaking to a whole nother world, but you're not bound by the social conventions that have kept law and order in this country.
What do you see happening? I'm curious, like if someone has an issue, because we said in the beginning, like if someone has a disruption in their life or they're not developing, as well as maybe they could be, whatever reason that creates problems down the line. Do you think about that when you're doing therapy with people in terms of, like how they're making their decisions and like, did one of these stages get fun?
Yeah. I mean, I really, and everybody who listens to this podcast heard me talk about self-advocacy. So if we're stuck in like, I have to follow the rules, I have to like respect my elders, and you're 35 and you have a shitty fucking boss who's a piece of shit, and you're not willing to advocate for yourself, that's regression, man. That is young behavior. If you are a fully formed adult, then you should be able to advocate for yourself and make sure your needs are getting met. And this idea here is we probably don't really do that until the social contract or that kind of post-conventional stage. So if any of my patients are listening, you've heard this speech before. I talk about getting my patients to fill up their bottle of fuck you juice. and I use that just exactly like you heard it. If we are meek or, we keep our thoughts to ourselves, then our bottle of fuck you juice is generally pretty empty. Because as I've said on this show, American culture is not designed for people to talk back. We are not taught to advocate for ourselves, and you have to really reach a final stage of maturity and growth in order to be comfortable doing that. So we have to find ways to get mad. We have to find ways to tap into the ways we've been wronged if we're ever going to leave a shitty marriage or we're ever going to quit a shitty job. People who don't develop in this way and aren't able to kind of see things in a grander sense, I feel just continue to struggle with that self-advocacy.
Yeah. Or it just seems like some people with conduct disorder, or like adolescents or kids can get stuck in a spot where the idea of a social contract or hurting other people is elusive. Most of them grow out of it.
Yeah.
But a lot of them don't.
Mm-hmm.
And the ones that don't, make up 60% of the prison.
Right.
And
3 to 5% of the regular population.
And to my recollection, I don't remember like a great intervention. I know there's a mentalization-based therapy that can be helpful with that, but it's like, we don't know a lot about how to catch those people up.
There's a combination, I think, when you're thinking about conduct disorder, and of course, there's like racial and socioeconomic aspects that are at play here. And also, it's hard. Conduct disorder is a cluster B trait. Antisocial personality is a cluster B trait. As we learned last week, the cluster Bs really like mix themselves up between each other. And so there's just this level of like narcissism that's also involved in antisocial, construct. You'd have to really grow and mature past that point to, and for the record, many prisoners do. Many people who spend time grow and learn, especially in good penal systems, which is not, unfortunately, the majority of them, because fuck profit prisons. And it's very sad, the state of the penitentiary system in this country. We'll cover that later. But the idea that these are also young people. They're young, impulsive, probably, mostly from impoverished backgrounds, and they're fucking dumb. And I don't mean that without love. They have ADHD most often. They are impulsive. They've been told they're bad their whole lives. So why would they believe anything else? Why would they shake that reputation of being bad? It's like creating a villain origin story,
That's true. I remember a student, it was like a younger elementary student that said to me, started a statement with like, well, when I go to prison, and I was like, wait, what?
Mm-hmm.
And it was like, well, and it was
it's inevitable in those communities.
Everyone around him gone to prison.
Yeah.
And so that was just something that he expected to happen. So I think this is a good segue into Albert Bandura, another pioneer. He saw some of these theories and realized that they didn't account necessarily for social conditioning or learned behavior aspect to the development. And, I think that's my experience is pouring that out. You can't expect someone to do, whether they're adult or child, can't expect them to do something they haven't been taught to do, or that hasn't been modeled for them. So either explicitly someone telling them, do this, don't do this, or having them watch somebody act in front of them, and I think honestly, the second of the two is the most world star videos where parent is going off and their little kid is right there, like also talking shit and swearing, and you're like, yeah, man, that's good for business.
We all get older. It does not mean we grow up, right? We talked about that. Like age is like truly just a number in the way that development, and that I want people listening to this podcast to see the world. You talked about you have to learn these things. They have to be modeled.
And I think that includes, reflecting on, talking about, and even to an extent, feeling your own emotions. And I have to, I often see kids who will come into the hospital, and adults for that matter, who feel like shit and maybe tried killing themselves, aren't even sure why they did that.
Yeah.
They're like, I feel like shit. And that's as far as they can go. And it's like, well, what kind of feeling like shit are we talking about? Like how, because I'm trying to figure out what's going on to see like, well, what can we do to intervene to help to shift momentum, whatever. And they can't tell you. And I think for men especially, but for everybody, a lot of that harkens back to their childhood and what for most people, there are some feelings when you're a kid that are okay to experience and to act out and to articulate. And there are some that are not.
Yeah.
And that usually depends on your parents who, and for them that, what's okay and what's comfortable for them to show depends on their parents. And so it gets passed down generation to generation.
Which are influenced by the grander society at large, right? We talk about this all the time. Like, there is a structure within this society that I believe transcends socioeconomic status, race, and religion, that there is this overlying theme of the women are taught to be the wives of soldiers. And that is how this system operates. So anger is generally okay. Masculinity, only in the toxic sense, is okay. Women are meant to be quiet, seen, not heard, all that stuff. I don't feel like I'm saying anything controversial when I say that, because that's what people come to therapy to combat. I cannot talk about my emotions. My wife wants to divorce me because I can't communicate. And to your point of Bandura, why on earth would they be able to communicate? When I'm pitching the podcast to people, Bill, I talk about the fact that I've had to learn these things and that inherently men can learn these things. But here's the problem out there, everybody, and I hope this, fuels this and continues to help the podcast grow. We know men did not learn these things. We know that men need to do better with their emotions. And to Bandura's point, we never were taught how. And women also have these difficulties, right? And both impacted by the way the society is. It looks different for them, but it's all in the grander scheme, right? So men, we clearly were not taught how to be better with our feelings, to the much of, the dismay of our fairer sex. And what's more, we are being expected to do it now. Well, nobody's fucking teaching us. So that's the thing that has frustrated me the most, and was one of the sources of me coming up with this podcast idea, is like, okay, I want men to do better. I'm a goddamn therapist, and nobody is teaching men how to do better. You have to want to go and seek out resources to do better, which is hilarious if people think that level of commitment is going to get the average person into therapy or start reading or start learning. Now, a lot of guys do, and fucking God bless them, right? But the average population has their head so far up their own asses, as we've talked about. Doesn't mean they're bad. It just means they're stuck in their own little world, that they're never going to pursue doing that.
I think the other thing to think about too is that the importance of doing it, you're taking that step, doesn't just affect you and your mental health. It also affects your kids' mental health to an extreme degree. And there's a lot of, just even scientific evidence for that like if your kids are having bad behavior or anxiety problems, especially if they're little guys, like best treatment for them is for you to get in your own therapy, in your own treatment. And I was just without even doing anything, no little play therapy or meds, certainly for little kids,
right?
Like the parents taking care of themselves produces results in their children without any intervention.
Kids read vibes. And so, yes, if I'm often trying to get a man in 30s with younger kids to, participate in therapy, I'll say, okay, well, if you don't want to work on that, that's fine. Try not to fuck your kid up. The idea of good enough parenting. I don't want to scare people, but like, if you don't have your own shit under wraps, just like a therapist, you don't have your own shit under wraps as a parent, you're going to take it out on your kid. It's almost a rule of thumb.
Super excited to induct Jason Segel, actor, into our Promotions Hall of Fame today. We talked about it at the top, the return of the TV show Shrinking. We'll get back to that in a little bit. Show fucking rules. Jason was born and raised in Los Angeles, California, where he was the middle of 3 siblings, older brother, younger sister. Something about that dynamic makes us therapists, huh? So Jason went to Harvard Westlake High School in LA, where he was coined Dr. Dunk. It's hard to believe now, doesn't seem like an athlete, but he's 6'4", apparently could throw it down. He was the backup center to Jason Collins. Sports fans in the crowd, that's right, Stanford grad and 13-year NBA vet. Jason went on to his acting career early on. He was in Freaks and Geeks, again, a show if you have not seen it, rules, an early Judd Apatow show with Seth Rogen, James Franco, Linda Cardinale. From there, he launched that success into playing everyone's best friend, Marshall Erickson, in How I Met Your Mother. That's a Jason quote. He realized at some point in his career that he's just always hired to play everyone's best friend. He then went into Knocked Up, and he co-wrote and produced Forgetting Sarah Marshall in the year of our Lord 2008. I'd be remiss if we did not take a quick sidebar to play you a clip.
It's getting kind of hard to believe things are going to get better. I've been drowning too long to believe that the tide's going to turn. And I've been living too hard to believe things are going to get easier now. I'm still trying to shake off the pain from the lessons I've learned. And if I see Van Helsing, I swear to the Lord I will slay him. Ha 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 ha, he'd take you from me, but I swear I won't let it be so. Ha 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 ha, blood will run down his face when he is decapitated. Ah, his head on my mantle is how I will let this world know how much I love you.
All right, I promised myself I would only play 1 minute from that movie, my favorite movie. If you have not seen Forgetting Sarah Marshall, just stop the podcast and go get it right now. So from there, Jason, starting a bunch of other stuff. The Muppets movie, because the Dracula scene in Forgetting Sarah Marshall had a bunch of Muppets in it. If you're a real KGB, you know we can only watch the Muppets movie in Dolby Surround Sound. Yada, yada, yada. He's done a lot of stuff. Last year, he co-wrote and co-created the TV show Shrinking on Apple TV. Co-created that with Bill Lawrence, the homie who created Scrubs, Ted Lasso, Shrinking. We've talked about him before. And of course, everyone's favorite angry soccer player, Brett Goldstein, who plays Roy Kent on Ted Lasso. So, Jason really appreciated the opportunity. He himself has been outspoken on anxiety and his need to go to therapy over the years because, as he said, there's no reason to live your life miserable. There's no shame in that. So we really appreciate Jason for that. He spoke in an interview on NPR about the idea of the show Shrinking and what role it serves with people, premised on the idea that we're all a mess. If you have not seen Shrinking, the idea is that we join Jason as he returns to his therapy practice. He's a psychologist, hence Shrinking. A year after his wife died in a car accident, he's the father of an older teenager. So, he really wanted to emphasize that we don't know what's going on in the lives of our therapists when they get home at night, and truly that we don't know what's going on in the lives of anybody when they get home at night, especially people that we're just interacting out there on the street. And so that we should remember to be kind to people because we don't know what's going on. So, Jason, of course, we can harbor that message. And I wanted to also share a clip from Jason talking about his own mental health on Conan O'Brien's podcast, Conan Needs a Friend.
I think also I have to personally work a little bit hard at happiness, like internally.
So it's a conscious choice you think that you're making every day to be a happy person.
I wake up, I have to work like a little harder to get to zero. And then I push,
Really?
and then I push it a little past zero.
It's interesting. It's probably a lot of people might say it's the last thing they would expect. I'm going to tell a personal story, which is when you were shooting your Muppet movie, you did the sweetest thing.
I like how Conan worded that, right? That might be the last thing people expect from a guy like Jason Segel. And I think we've come to understand that most comedians struggle in some way. I don't want to generalize that, but a Robin Williams, who we know struggle with depression, that generally that kind of humor comes as a defense from negative emotions. So I really appreciate Jason's openness and willingness to talk about his mental health struggles over time, and then to produce a show like Shrinking that shows us that while it is not a good example of how to practice therapy in terms of boundaries, it is a good example of how we can build relationships with people and really be supportive in times of need, whether you're a therapist, a lay person, or just another human in this world trying to be kind. So, Jason, Bill, Brett, I owe you huge thanks, because I've said on this podcast before that Shrinking is the reason that I fell back in love with being a therapist. And we wouldn't be listening to this podcast right now without that show. And so thank you all. Super excited to watch this second season, which starts today. If you think Forgetting Sarah Marshall is not the best Jason Segel film of all time, you're free to reach out. I'd love to hear your argument. All right, everybody, we'll be back to wrap up in a sec. All right, y'all, we're going to close this one out. As we do, we're going to cite our sources. Not a ton today. We use some of the images from the development lecture with Bill we got from simplepsychology.org and Very Well Mind. Super useful resources, both of them. Thank Conan O'Brien for letting us borrow a clip from his podcast, and Jason himself for the clip of him singing the Dracula song during Forgetting Sarah Marshall. Takeaways from today, 3 of them. First, from the first segment, the word actually implies surprise. When you say to somebody that was actually pretty good,
you may be hurting their feelings. Let's try and take a minute, take a breath, and say what we mean. Number two, that when we understand the way we develop, that can inform our inner world, how we function and what we're dealing with, and of course that of others to help us be more kind. Number three, as Jason Segel told us, we're all a mess and we don't know what's going on for someone at home. So we want to be kind. Remember the difference between being nice and being kind is to be kind is to understand someone else's experience. So let's stay on this journey. Let's keep learning. And remember, this week when you're out there, do your best to be kind and gentle. See you next week.